We're back on MD-VOD with some questions that we just got off the digital universe and from Facebook and Twitter. And don't forget to send us your questions for us about colon cancer. First question is Lexi27. This is for you, Dr. Schecter. What's the most important thing I should ask my doctor if I'm diagnosed with the disease? It's a great question.
It is a good question. And this is where it's so important to have a one-to-one dialogue with your physician so he can explain to you where exactly your colon tumor is and where it might lead to as far as treatment is concerned.
Okay, great question, good answer. Mad Mike is up next. Typically, a patient will get back what's called a pathology report. Can you explain what that is and what it usually says?
Right, so a pathology report usually talks about something called histology, the kind of cells that might be in your polyp or the kind of cells that might be in your tumor. And it kind of grades the severity of these cells, how malignant they are, and that helps as far as diagnosis and treatment is concerned.
So great question. So pathology is looking under a microscope at a piece of that polyp or even tumor under the microscope, and that helps us gauge what kind of therapy is next. That's a great question. Jonathan, 64, wants to know, are there any new advances for treating colon cancer, and are there any on the way?
Well, I think the biggest advance is the new techniques in surgery. Mm-hmm. The new techniques involve laparoscopic surgery, so they can take out your colon on a Monday, you'll be home by Wednesday.
Wow.
So that's a huge advance from the old days where you had a large incision, you were in pain for a week, couldn't go back to work for a month. So surgery has been a huge advance.
Wow.
And the second advance is the new chemotherapy agents, which actually can cure colon cancer.
Great stuff. So laparoscopic surgery requires a much smaller incision. It improves pain if you have a smaller incision, and you get out of the hospital sooner. So that's a great point about the advances we've made in treating colon cancer, and some of these chemotherapeutic agents are better as well. Doctor, let's see, we have Karen, 576. This is a very draining disease mentally for the family and the patient. What are some organizations that can help the patient and their family cope with all of this? Is there anything out there, any support groups for colon cancer?
I think it's important to have a good discussion with your doctor. He should be your main support, but he has help too. He has help from people in social avenues, people from the American Cancer Society, but it's a long process, and your family is your most important help when it comes to having any form of cancer, I feel.
But there is certainly, it's important to talk to others. The American Cancer Society has support groups, there's blogs and so forth that you can share your experience with others, and sharing with others is certainly a therapeutic way of coping with it. Dr. Schecter, I want to thank you so much for being with us. That was outstanding information, some great take-home advice. For anything you missed, please go to emPOWERme.tv because there's all of this and more to answer your questions about anything we've discussed on MD-VOD.